Namaskar, this is Dr. Hema Divakar, the chairman of ARTIST, which reads as Asian Research and Training Institute for Skill Transfer. At the ARTIST Skill Gurukul today, we are proud to be conducting the first ever quality training program for safe deliveries. It is now known that in the entire country, many women are delivering in hospitals and institutes rather than in homes. 80 to 95% of the women who deliver in the institutes, the question that we have to reflect on is, are they getting what they deserve? Are they getting the quality of care in these institutes? Or is it just that the venue is shifted from home to the hospitals and there's just nobody competent enough to render the quality service, prevent the complications, save lives, and give her the better care? So what's the whole point in this shift from home to hospital if we do not ensure that the lives are saved? So in this context, when we did a baseline survey in the Merrygold chain of hospitals in the entire Rajasthan belt, involving the Jaipur, Jodhpur, Kota, Alwar and Udaipur districts, and took into our fold about more than 75 private institutions which are rendering care for the women and the newborn, we recognized that the steps that they need to follow when the woman is admitted at delivery, the steps that they need to follow during the process of delivery, the care that they have to offer if she gets into complications, and how they would manage the newborn, what is the care and advice that they would give on the next day of her delivery, and with what advice would they send the mother and baby home for a short-term and a long-term follow-up, including the immunization and the contraception. When we studied this, we were very disappointed to find that they don't even match about 20 to 22% scores in terms of the quality rendering of the services. So it is our mission that through ARTIST, we will master train a set of teams from the hospitals, both the doctors and the paramedical staff who are the frontline healthcare providers or those in the front line which actually handle these cases. Their teams have to be trained in each and every micro step and aspects of the A to Z of how to render the quality delivery care. So this whole concept of skill transfer is getting translated into practice at the 3-day workshop and a continuum of skills training, creating skill stations from readiness to delivery, as in preparing the equipment, from the actual conduct and assessment of a normal delivery process, for the care and resuscitation of the newborn, and for the care of the mother in terms of her postnatal and contraceptive services, and also the advice that they would give to the newborn. So everything in the form of role plays, mimicking with simulators, namely the mama natale and the neonatale, where they get the first-hand experience as if they were conducting the delivery process live, as if they were handling the complications in a real-time situation. So the mock drills and the rehearsals and the kind of exposure that they get with the hands-on, we recognize that when the teams are called in to perform a delivery process, for example, the first time on, they're about nearly there, 30-40%, all right, and then after the one round of coaching and trying to tell them this is the right way to do, they get to about 60-65%. Then the third round of the skill drill, they get nearly to 80-90%, and there's always another attempt made for them to score 100 on 100. And that is how intense these training programs are, and that's how hands-on these training programs are. So when they walk away from this course, no matter whatever the environment or the circumstance, it is so well ingrained in their system that the process flow will be as flawless as we expect it to be. Now, these master trainers who have now arrived from Rajasthan from the Hindustan Latex Family Planning Promotion Trust, that is the HLFPPT, which has a franchisee unit of hospitals known as the Merrygold hospitals in the entire Rajasthan belt. So whoever is in the chain of the Merrygold hospital in all the geographies that I mentioned, these master trainers will go back and take individual group trainings, both in a common setting and also a supportive supervision in their own private hospitals. The most difficult aspect, as you know, is to change the behavior, because somebody who has been doing the same things over and over again for many years will not change suddenly with one training course. So our champions are going to be going there and training and retraining, helping them unlearn and relearn the techniques in protocol-based practice for safe delivery, to let them do the things in the manner that they're expected to do, and to make sure that as how they have reached the 100% score, each of these institutes will move on from 20% to 40% to 60% to at least 80%, when we would think that most of our job is done and many lives of both the mothers and the babies would be saved. So to step up the quality of care, both maternal and the child health care, this is the first major attempt by a private setting, as in the artist Skill Gurukul, who is imparting this intense skill transfer, hands-on training in safe delivery processes to the teams of hospitals in an attempt to master train them in a cascading manner, so that this learning reaches in a practical and a pragmatic way to every institute in the first phase in the geographies that is mentioned. Of course, we recognize that the country is large, and this is just a small step for a great beginning for many more private hospitals in the entire Uttar Pradesh and Bihar belts, and then on to Assam and other parts of the country, and wherever the HLFPPT Marigold chains are into the franchisee unit. It's our dream that after this training, each and every such private institute will be recognized as a very powerful chain imparting quality services of a very high standards to the women and the newborns in this great country.